I'm joined in studio by our resident doctor, Dr. Layla, and today we're talking about irritable bowel syndrome. It's not that pretty of a topic, is it, Dr. Layla?
It's never. Anything to do with bowel is never pretty.
Well, it's actually one of the top trending topics on Health 24 right now, so we thought we would unpack it a little bit. And I want to start off by talking about what exactly irritable bowel syndrome is.
Sure. The medical definition is basically when you have symptoms in your gut that are not related to an actual anatomical problem in your colon. So irritable bowel syndrome can manifest with things like bloating, cramping, frequent diarrhea, frequent constipation. Even heartburn can be manifested from IBS.
How do you get IBS?
Well, interestingly, one of the big reasons is stress. So if you're a person who's prone to getting gut issues when you're stressed, then IBS is caused by stress. One of the biggest other causes is, of course, our diet. And as we know, there are so many foods nowadays that are also buzzwords, you know, lactose intolerance, gluten, those things all relate to getting IBS.
Now, how do you determine which thing is causing your IBS? Is that the point where you see a doctor?
Yeah, absolutely. You know, as integrative doctors, generally, we look at those things in every patient. What are their stress factors like? Are they resilient to their stress or not? And then what are they eating like? You know, because that's important for everybody, and however it manifests, it's an important place to go anyway.
All right, how do we treat it? Once we have the symptoms, once we know it's IBS, what do we do?
Yeah, so very importantly is starting to work out which foods are a problem for you. And most IBS patients will know immediately, you know, when I drink coffee, this happens. But there are usually foods that we tend to get used to that we eat every day. Things like drinking milk, for example, that we might not realize is causing a problem in our gut. And so generally we put patients on something called an elimination diet, where we get rid of the most likely foods and then get them to introduce it one at a time and test how their gut reacts. So dietary-wise, it's a great control. And then, of course, with their stress, we manage stress in many ways. You can either use herbal medicine, you can use drugs, and you can go for psychotherapy and manage your stress.
What are some of those most likely foods that can contribute to IBS?
Yeah, I would say, good question. We usually cut out things like dairy, cow's milk specifically, gluten, which is rye, wheat, barley, kamut, all of those things. Sugars, big one. Not necessarily the xylitol and the stevia, but cane sugar and even honey can be a problem. Those are probably the top three, but there's a long list.
All right, at what point do we need to see a doctor if we're experiencing gut issues?
I think the point that it becomes uncomfortable, where you feel like I can't live like this. At the point that you feel there's a pain here. You know, when we start living on things like laxatives for constipation, we can cause more problems. Or when you're using something for diarrhea all the time, you can cause more problems. So when you're noticing that I'm needing to use medication more often than not, I think that's a good time to see a doctor.